We are here to discuss with you the methods of prevention for infectious diseases. This includes increasing the amount of immunizations and reducing the rate of preventable infectious diseases through research and evaluation activities. The first infectious disease that we're going to talk about is HIV and AIDS. HIV is the human immunodeficiency virus. It is the virus that can lead to acquired immune deficiency, also known as AIDS. People living with HIV may appear and feel healthy for several years. However, even if they feel healthy, HIV is still affecting their bodies. The Center for Disease Control estimates that 1.1 million Americans are living with HIV, and out of that 1.1 million, 1 out of every 5 of them do not know that they're infected. The number of people living with AIDS is increasing due to the fact that effective drug therapies have been developed, which keeps HIV-infected people healthy for a longer amount of time. The HIV has implemented a program to improve treatment, care, and support for persons living with HIV and AIDS, and to build capacity and infrastructure to address the HIV and AIDS epidemic in the United States and around the world. HIV is a little different from other infectious diseases in the fact that there is no vaccine to block the transmission of the disease. The only way to block it is to take preventative measures such as using a condom, using clean needles, abstaining from having multiple sex partners, as well as empowering communities and creating an enabling environment. This prevention method is referred to as combination prevention, and it offers the best promise of success. Within CDC, there is a center called Division of HIV/AIDS Prevention, also known as DHAP. This center has been charged with the mission of preventing HIV infection and reducing the incidence of HIV-related illness and death. There are 2 divisions within this center. One is intervention research and support, and the other is surveillance and epidemiology. The intervention research support provides national leadership and support for HIV prevention research, and the development, implementation, and evaluation of evidence-based HIV prevention programs serving persons affected by or at risk for HIV infection. The surveillance and epidemiology provides national leadership for HIV prevention research and surveillance, and the development and testing of effective biomedical interventions to reduce HIV transmission and HIV disease progression in the United States and internationally. Since the first case of HIV in 1981, the CDC has been on the front lines of the battle against HIV and AIDS. The number of annual new HIV infections has fallen by more than 2/3 since the height of the epidemic, and HIV-related deaths have dropped significantly since the antiretroviral therapy started in 1996. The most recent breakthrough showed that early antiretroviral therapy could reduce transmission by 97%. There are still many gaps in the HIV and AIDS prevention, but there are several organizations out there that are trying new methods of prevention and informant education every day. The CDC set goals to accomplish by the year 2015. The biggest mission in this goal is to create easy access to care for those living with HIV and AIDS, and to increase the prevention and care services that are made available for all Americans. CDC's new approach suggests that HIV testing be a part of all routine medical care as a screening test.
Hi, I'm going to be talking to you today about hepatitis, which is one of the main infectious diseases worldwide, and also a topic in Healthy People 2020. Hepatitis is the inflammation of the liver. The most common types of hepatitis are A, B, and C. Viral hepatitis is the main cause of cancer and the most common cause for liver transplant. According to the Center for Disease Control, 4.4 million Americans are living with chronic hepatitis, and most do not know they are infected. 80,000 new infections occur each year. The populations at risk for hepatitis are Asian and Pacific Islanders, people with HIV and AIDS, homosexual men, injection drug users, and people with STDs. There are 5 types of hepatitis: A, B, C, D, and E. Hepatitis A ranges from a mild infection to a severe illness that can last several months. Hepatitis A is contracted from ingesting fecal matter, even in small amounts. Hepatitis A vaccines are recommended for all children starting at age 1. Hepatitis B can be acute or chronic. Hepatitis B is spread through bodily fluids from sexual contact or sharing needles and syringes. Hepatitis B can be spread from mother to child at birth. The Center for Disease Control recommends testing and vaccination for all countries where hepatitis B is common. Hepatitis C is spread from blood of an infected person entering the body of someone who is not infected. This disease is most commonly spread by sharing needles used for drug use. Hepatitis C often becomes a chronic disease that can lead to cirrhosis and liver cancer. Hepatitis D is very uncommon in the U.S. and only occurs among people who are infected with hepatitis B. Transmission requires contact with infected blood. Hepatitis E is rare in the U.S. but common in other parts of the world. It is similar to hepatitis A because it is transmitted from ingestion of fecal matter. Hepatitis E is usually associated with contaminated water supply. Currently, there are only vaccines available for hepatitis A and B. If you have been around someone with hepatitis or believe you could be infected with hepatitis, you should contact your physician to get tested. And for more information on hepatitis, you can visit the CDC website.
Hello, I'm going to be talking about tuberculosis. It is a disease caused by a bacterium called Mycobacterium tuberculosis. The bacteria usually attacks the lungs but can attack any part of the body such as the kidneys, the spine, and brain. If not treated properly, tuberculosis can be fatal. Symptoms include a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood, weakness or fatigue, weight loss, no appetite, fever, and sweating at night. There are 2 kinds of tests that are used to determine if a person has been infected with TB bacteria. The first one is the tuberculin skin test. This test is performed by injecting a small amount of fluid into the skin in the lower part of the arm. Within 48 to 72 hours, it will be checked for a reaction that includes raised or like a hard area or swelling. A positive skin reaction means the person's body was infected with TB bacteria. And a negative skin reaction means the person's body did not react to the test and that TB infection is not likely. TB blood test measures how the immune system reacts to the bacteria that causes TB. The TB blood test, also called interferon gamma release assays or IGRAs, 2 FDA-approved IGRAs are available in the U.S. include QuantiFERON, TB Gold N-tube test, and T-Spot TB test. There's the positive IGRA, which means the person has been infected with TB, and the negative IGRA, which means the person's blood did not react to the test and TB is not likely. TB bacteria becomes active, meaning it multiplies, if the immune system can't stop them from growing. TB can be treated by taking several drugs for 6 to 9 months. There are currently 10 FDA-approved drugs in the United States. It's very important that people who have TB finish the medicine and take the drugs that are exactly prescribed. How is it spread? The TB germs are put into the air when a person with TB disease of the lungs or throat coughs, sneezes, speaks, or sings. These germs can stay in the air for several hours, depending on the environment. Persons who breathe in the air containing these TB germs can become infected. This is called TB infection. Vaccines include BCG. This vaccine is not widely used in the United States. It's often given to infants and small children in other countries where TB is common. However, it is not always 100% effective. And who should get tested? People who have spent time with someone who has TB disease, people with HIV infection or other medical problems that weaken the immune system, people who have symptoms of TB disease like fever, night sweats, cough, and weight loss, people from a country where TB is common, and people who use illegal drugs. If you have been around someone who has TB disease, you should go to your doctor or your local health department for tests.
Hi, I'm going to be talking about vaccines today. And while in the past many fatalities from infectious disease were a major and deadly problem, today vaccines have done much to eradicate and rid the world of disease. A vaccine is a weakened or the weakened or dead germ or microbe that is injected into a person to cause a person to build up defenses against the particular substance. Vaccines serve to help to prevent the outbreak and spread of diseases across the states and the world. According to Healthy Children, in 2007, vaccines are estimated to have prevented 14 million infections and saved 33,000 lives. Healthy People 2020 says that because of vaccines and immunizations, there has been a huge drop in the number of infant fatalities in even just the past 20 years. They also say that even though there is a dramatic improvement that has come about because of vaccinations, there is a lot more that could be done to improve immunity among the general population. Several infectious diseases that are very preventable, but people still die from today, include tuberculosis, viral hepatitis, and influenza. While the benefits of vaccination are so evident in even just simple statistics, there are some who are still skeptical and think that vaccines cause more harm than good. Some even think that vaccination can cause autism or brain damage in children. While this fact may or may not be true, there is a much greater risk that comes with not getting the recommended vaccinations than there is with receiving them. According to Immunity, a child is 100 times more likely to get struck by lightning than to have a severe allergic reaction to a vaccine. According to Healthy People 2020, vaccination saves 33,000 lives, prevents 14 million cases of disease, reduces direct healthcare costs by $9.9 billion, and saves $33.4 billion in indirect costs. And Healthy People 2020 also says that despite progress, approximately 42,000 adults and 300 children in the United States die each year from vaccine-preventable diseases. Communities with pockets of unvaccinated and under-vaccinated populations are at increased risk for outbreaks of vaccine-preventable diseases. One of the reasons that certain diseases are still present today is because people do not recognize the high level of importance in vaccinating their children. The areas with a lack of vaccination are much more likely to contract diseases and have them rapidly spread into an epidemic. According to Immunity, in 1975, Japan stopped vaccinating against pertussis. Just 5 years later, they went from having 373 cases of pertussis to 13,000 cases and 41 deaths. Outbreaks of measles, mumps, and pertussis are occurring around the United States, often among groups of children whose parents choose not to get them vaccinated. By choosing to not vaccinate your children, you are not only putting them at risk, but also the community that you live in, because you are presenting your children with the possibility of spreading the disease that they contract to those around them. When the majority of a population comply to vaccinate their children and themselves, herd immunity results. Herd immunity is when most of a people group is immune to a certain disease. Today, there are millions of people who travel all over the world. Because of this, there is a great possibility for diseases to be contracted and spread throughout various countries very quickly. This is yet another reason for us to emphasize the importance of vaccinations. According to CDC, research is being done to identify groups at risk of contracting vaccine-preventable diseases, stimulate efforts to increase coverage, and evaluate how well the efforts work. According to Healthy Children, in recent years, newer vaccines have made dramatic inroads in fighting even more diseases. Another avenue of expertise is National Vaccine Information Center. National Vaccine Information Center is an organization that currently exists to provide information on preventable diseases and the vaccinations that are available for those diseases. In order to find more about vaccinations and this organization and what it stands for, you can visit www.nvic.org.
In tandem with Denise's discussion on vaccines, Healthy People 2020 seeks to stress the importance of such immunizations, especially in children and in infants. With new emerging immunizations and circulating rumors on the internet and the media, many may wonder if they are of greater benefit than of harm. We can rest assured, though, that immunization recommendations are published after extensive research by a group of 15 experts in the field of immunization selected by the U.S. Department of Health and Human Services, known as the Advisory Committee on Immunization Practices, or ACIP. Others may question the safety of recommended immunizations, especially the ones developed in the last few centuries, like the influenza vaccine or the meningococcal conjugate vaccine. Significant information has come out, though, denying significant links between immunization-related reactions or disease. The Mayo Clinic performed a long-term study on autism in 2005, the first of its kind, in Minnesota, and found the rise in autism diagnoses was connected to the broadened, more precise criteria for autism established in 1987, as well as improved awareness. In addition, according to the U.S. National Library of Medicine, research has led the American Academy of Pediatrics and the Institute of Medicine to agree that no vaccine or part of any vaccine is responsible for the number of children currently being diagnosed with autism. Ultimately, the benefits have outweighed the risks, and it is important to think about the risks of not having the vaccination at all. Several updates to immunization recommendations, as found on the 2010 Morbidity and Mortality Weekly Report, have been made, including a greater push for influenza vaccines ever since the 2009 Influenza A H1N1 pandemic. Specifically, Healthy People 2020 is advocating child immunizations and making sure people are aware of and encouraged to take their children to receive 11 certain vaccinations before the age of 2. And these 11 vaccinations include the hepatitis B vaccine, or Hep B, the rotavirus vaccines, or RV, diphtheria and tetanus toxoids and acellular pertussis vaccine, or DTaP, the Haemophilus influenza type B conjugate vaccine, HIV, the pneumococcal vaccine, inactivated poliovirus vaccine, or PV, influenza vaccine, measles, mumps, and rubella vaccine, MMR, varicella vaccine, VAR, hepatitis A, Hep A vaccine, and finally the meningococcal conjugate vaccines, or quadrivalent MCV4. Now, the immunization schedules, names, and when children should have their immunizations can be overwhelming, but information is readily available to the public and can be found on www.cdc.gov/vaccine. This includes documents for keeping a record of vaccines taken for school systems if paperwork is not provided by the schools, charts of when immunizations should take place for healthcare providers, and an easy readable format for parents, and even a tool that can be used to enter a child's date of birth that generates exact recommended dates of when immunizations should be made for the child. Overall, Healthy People 2020's goal of decreasing preventable infectious disease via immunization rates is an achievable and practical one. If we all band together, we can foster a healthier next generation. We can help to protect our loved ones, children, and selves from unnecessary harm. Thank you.